I'm Gemma. I'm head nurse at Warren House Veterinary Centre, and today we performed a castrate on our lovely little Rio. So when Rio came in this morning, he went through a 15-minute admission appointment with one of our VCAs. Then the second thing that is done after the patient's been weighed is they come into kennels and they have what we call a TPR performed. So they have their vitals taken essentially. Then we go through to start preparing the drugs. So this involves a pre-medication. It consists of a pain relief and a sedative mixed together in the same syringe, so it's just one injection, and it makes them fall asleep. So it doesn't send them completely under anaesthesia, but it makes them nice and relaxed, it makes them much sleepier. They don't tend to remember so much what happens once they've come round. So with that pre-medication on board, it makes them more relaxed, it makes our job easier, and it makes their lives nicer. When that animal's sleepy enough and the pain relief has started to kick in, which tends to be after 15-20 minutes, then the vet will place an IV cannula in their leg, which means that we've got access to their vein. And once we've got access to their vein, we tape it in place and we secure it. And then the propofol is given. It's a barbiturate, it sends them to sleep slowly. That's when they're okay to have their endotracheal tube placed, which is the tube that secures their airway. So it means that we can control their breathing whilst they're under anaesthesia. And then once we're happy with all of that, we will then move the patient through to theatre once we've finished clipping and preparing the surgical site for the actual procedure of the castration. Then the surgery is performed, an incision is made what is called pre-scrotally, so it is just before the scrotum. The testicles themselves are actually inside the scrotum, so the scrotum stays and the testicles are the bits that are removed. So they're pushed up through the scrotum, and then they are tied off with what we call ligatures, which tie off the blood vessels and the ducts so that nothing can come in or go out anymore. And then chop, off we go, done, and then everything is sutured up afterwards. So here we use intradermal stitches with a dissolvable suture material. So that means that your pet doesn't need to come back to have stitches removed in 10 to 14 days, as was always sort of traditionally done in veterinary practice. Once that has been sorted and the animal started to wake up, we transport them back to kennels, and our dedicated recovery team are there to give one-on-one support to them until they are able to stand, walk around, go back to normal, and then hourly checks once they are up and walking around. We try and just reassure them that they're okay, that we understand that they don't understand what's just happened to them, so we try and be as reassuring to them as possible and treat them how their owners would want to be treated and would treat them, and try and keep everything as normal as possible for them, and then get them home. Go through a quick discharge appointment with their owners to advise them on all the post-operative home care, and then see them back in 3 days for a post-op check and see how they're getting on.